If you have a pain on the outside of your hip and you want to avoid painful injections, x-rays, and or MRIs, or waiting months to see a specialist to figure out what's going on so you can move beyond your diagnosis and treat it naturally, then in this video I'm going to give you everything you need to figure out the most likely source of why you hurt. Here are some of the most common causes. We're going to walk through these one by one. Basically, I'm going to walk you step by step and ask you to go through this with me. Through a complete diagnostic flowchart, I'm going to give you all the self-movement tests you need to perform, as well as all the questions you need to ask yourself to figure out why you hurt. Now, you might be wondering who I am. My name is Dr. Charlie Johnson. I'm a physical therapist. My knowledge and experience place me in the top 0.5% of specialists in the world. So let's dive into it. You're here because you have pain on the outside of your hip. You don't have back pain. You don't have pain, numbness, tingling going down your leg below the level of the knee into the foot, just pain on the outside of the hip. And here are the most likely causes. Again, we're going to walk through them step by step, starting at the top, working our way down. So first things first, we want to rule out big, ugly, scary things like cancers, tumors, fractures of the hip, which could cause you to feel pain on the outside of your hip. Then we're going to talk about more common things, which, believe it or not, can cause you to feel pain on the outside of your hip, even if you don't have pain, in this case, in the back. So things like disc herniations might not cause you to feel back pain. You might just feel pain on the outside of your hip or in your butt or somewhere else. Facet joint problems in the low back caused by degenerative joint disease, arthritis, can again cause pain to be referred to or sent from structures of the back to the outer hip. There might be problems within the hip joint itself, which causes you to feel pain on the outside of your hip, or maybe it is a problem on the outside of the hip actually. We call this Greater Trochanteric Pain Syndrome. This is kind of the umbrella term for things like glute tendinopathies and hip bursitis issues. Also, believe it or not, it's not often spoke of, but believe it or not, the mind and or brain can cause you to feel very real physical pain on the outside of your hip, the kind where you take your finger, you push, and you say, ouch, that's where it hurts right there, but it's actually not caused by damage of a tissue in your body. Instead, it's caused by a sensitive central nervous system. We call this central sensitization. I'll actually have you walk through a complete list of questions to help you figure out if this is the probable cause. And right off the bat, you definitely don't have Piriformis syndrome if you have pain on the outside of your hip solely, and you do not have sciatica. I'll share with you why in this video. So to start things off, body damage to the tissue in or about the hip or in the back, or the joint itself can cause you to feel pain on the outside of the hip, or again, your brain or your mind can become a little bit sensitive and cause you to experience symptoms that are very real. They're not made up, they're not on your head, but they're not due to damage of the structures in your body. So let's first rule out cancers that cause your outer hip pain by referring to this article right here. Now, this article has come up with a cluster of findings, which is very good at screening for cancer as the cause of back pain, but I'm going to apply it also to kind of this hip pelvic pain area as well, because I think it can also be very useful. So, not very common, 0.6, so 6 out of 1,000 people present with back pain, but again, I'll kind of apply this to the hip broadly and say still not very common, that cancer is going to be the cause of your hip pain, but something we don't want to miss. So here's the cluster of findings. Are you greater than 50 years old? Do you have a previous history of cancer? A previous history of cancer is often the greatest predictor of cancer as the cause of back pain, but also in this case, maybe pelvic pain, outer hip pain. Do you experience unexplained weight loss? You're losing weight, but you don't know why. If so, this is a sign that something else systemically might be going on, maybe cancer, tumor, something like that. Are you failing to respond to natural treatment? If you have a physical problem on the outside of your hip, which should get better over time, and or the right treatment should fix it. But if it's not, maybe it's not a problem of the hip that you can fix. So, cancer causing back pain, but again, I'll ask that we try to apply this at least loosely to this outer hip pain. Can be ruled out with 100% certainty if the patient is less than 50, if you do not exhibit or aren't experiencing unexplained weight loss, if you do not have a history of cancer, and if you are responding to natural treatment. That being said, if you do have a previous history of cancer and you have pain on the outside of your hip, then chances are it would just be safe, rather be safe than sorry, to refer out for an x-ray as well as some blood work, ESR, erythrocyte sedimentation rate, looking for markers of inflammation in the blood. Or if you check 3 out of 4 of these boxes, then we may want to also refer out to get some further testing done. Fracture. 1 out of 1,000 people. There's something called the Collingwood hip fracture rule that we can use to kind of screen for hip fracture as the cause of your outer hip pain. Keep in mind that these things are pretty darn clear. Usually you're going to know if you did something really, really bad, like a fracture of the hip, as you can see here in this picture. But that being said, there are some things that even before you would go get this checked out, maybe you just fell and hurt yourself and you're like, what did I do to my hip? That can screen for the presence of fractures that cause your outer hip pain. So, are you female? Postmenopausal, there are some hormonal changes which might affect bone density, bone health. So this increases the risk of fracture more so in females than in males. Are you greater than 65 years old? Did you notice the onset of your outer hip pain following significant physical trauma, usually a fall? Could be a car accident, something like that. Are you unable to weight bear on the painful side? Just hurts too bad. Do you notice that you have a shortened and rotated leg on the painful side? So hopefully you're not sitting on the ground somewhere watching this because you've just fallen. But if you have some of these things and you look and your painful side is slightly shorter, at least in appearance, and flopped out to the side, then maybe we have fractured the neck of the femur or something within the hip joint. And bruising on the outer hip is often something that will occur when folks fracture something within their hip. So they'll get bruising to the butt and outer hip region in this area. If 3 out of 6 of these boxes are checked, then we're going to refer out for further medical imaging, x-ray, and or MRI to rule out fracture. Now, let's talk about more common things. Believe it or not, the back can cause you to feel referred pain to the hip, even if you have no back pain at all. So we first want to screen for that. Disc herniations, facet joint problems, then in the hip joint problems, and then down the lane. Okay, so you do not have Piriformis syndrome. Sometimes figuring out the most likely source of your symptoms is not so much about ruling in what it could be, but ruling out what it is not, so we can get closer to the truth. So Piriformis syndrome, also termed as deep gluteal syndrome, just a broader stroke to help people understand that there's many things in the butt that could be causing pain, not just the piriformis itself, is unlikely to be the cause. Because we know from a lot of pain referral studies that piriformis syndrome causes pain deep in the glute, hence why we label it big picture as deep gluteal pain syndrome, DGS. Versus you have pain on the outside of your hip. So because you have pain on the outside of your hip and not in your butt, then you do not have piriformis syndrome. You do not have sciatica. Sometimes people say, my sciatic nerve feels like it's irritated, it's pinched, something like that, and I have pain on the outside of my hip. You do not, because oftentimes sciatica will refer, in almost all cases, with pain, numbness, tingling that goes below the level of the knee into the foot. Now, it can cause you to feel pain on the outside of the hip, but it almost always causes pain below the level of the knee into the foot. Numbness, tingling, burning, shooting, electric, cut my leg off pain. And because, at least for the sake of this video, you don't have this, and you are not experiencing these symptoms, you do not have sciatica. So it's not a nerve problem. Now, again, it could be an upstream problem in the back causing you to feel referred pain to the outside of the hip. Let's then move the structures of the back to see if we can cause you to feel pain in your outer hip region. And again, this applies even if you don't have back pain. It's possible a back problem could cause your outer hip pain. So here's what we want to do. We want to wiggle the joints and the discs and all the structures of the back, and I have found in my experience that if the back is a problem, you should be able to elicit pain in the outside of your hip, if the back is the cause of the outer hip pain, by moving in the backwards direction in at least one of these 3 directions. So first things first, a back bend center. So feet shoulder width apart, place your hands on your hips, and I want you to bend back as far as you can tolerate. Now, you might not feel back pain, but you might notice some stiffness. You might get a jolt of pain or a shot, a stinging, a burning in the outer hip. It tells you that we didn't move anything about the hip itself. We'll talk more about that in a moment. But the structures of the outer hip, the bursa, anything like that, we just bent backwards. So we flicked the switch, which is the lower back, and we turned on the pain in your outer hip. It's a back problem. Something in the back is irritated, a joint, a disc, something like that. Now, if that wasn't painful, keep moving along. So go ahead and perform test number 2. We call this a rotation extension test. Rotate your trunk fully to the left and bend straight backwards. What happens with that? Does that shoot pain into the outer hip? Now rotate fully to the right and bend straight backwards. What happens there? Does that reproduce the pain that you feel on the outside of the hip? It either does, it's going to be painful, that causes pain on my outer hip, or it's going to be pain-free. Let's talk about what happens if it's painful, and we'll revisit what happens if it's pain-free or what that means. So if it's painful, it's likely a back problem, a disc problem, a facet joint problem, but it could also be a hip joint problem. Stick with me, we're going to explain why here in a moment. It's likely not to be a glute tendon problem, hip bursa problem, or that trochanteric pain syndrome problem, that overarching term for these 2 things, because again, when you bend backwards, you're not moving any of these things. So it's more likely to be something upstream. Now what I want you to do is I want you to retest and do the same thing again. So you're going to do the back bends, but this time you're going to take, if your symptoms are on your left side, you're going to put your left leg up on a box. You're going to elevate that such your hip is a little bit forward and your knee is bent. Put it on a box that's 4 to 6 inches in height, a yoga block, a stack of books, something like that. Bend straight backwards. Now, it was painful when your legs were straight, but is it still painful or is it not? Is it still painful or is it now all of a sudden pain-free? And what does that mean? We'll talk about that here in a second. But retest it. Back bend straight. Now rotate your trunk fully to the left and then back bend. Rotate fully to the right and then back bend. That's if your symptoms are on the left side. Now, if you have pain on the outside of your right hip, put the right leg up, as you see here. Back bend straight, rotate to the right, back bend, rotate to the left, back bend. One of two things can happen. It was painful here, but now maybe with the leg bent, it's pain-free. We'll talk about what that means in a moment. But perhaps you have the same result. It doesn't matter if your leg's straight or your leg's bent. It still hurts. It's still yucky. It's still painful. Well, then this tells us that it's likely not a hip joint problem, but instead, it's most definitely a back issue. Now, let me explain why. So we did the same back bend motion, but the only thing that was different was the position of the hip. So the back position was the same. You can see here as indicated by that green arrow. The hip position is different. You can see here we slacken the front of the hip. And with the leg straight, there's more tension on the front of the hip. And if the result was the same, it was painful when you did the back bend with the leg straight, and it was painful when you bent backwards, then it points to being a back problem because the hip and thigh position doesn't matter. It doesn't matter if you move it like this or you move it like this. You still have the same painful result. Not a hip problem, a back problem. Now, in the scenario whereby when you bent backwards with your leg straight, it was painful, but all of a sudden when you bend your knee or your hip, it's no longer painful, then this points towards it being more of a hip problem. Because when you move the hip and you change the position of it, it changes your result. The back position or the back arch did not change. So it's not a back problem, it's a hip problem. Now, let's segment it further. Are you greater than 50 years old or are you less than 50 years old? This helps us get closer to the truth as it relates to, okay, now it's a back problem, but what in the back? What structure in the back is likely to be the problem? So if you're greater than 50, you can see here based off of this chart that as we move beyond 50 years old, we're more likely, meaning we have a higher probability of pain coming from joint issues, degenerative joint issues, arthritic issues, facet joint problems, FJA, facet joint arthropathy, arthritis in the joints of the lower back. Doesn't mean that it can't be a disc problem. It just means that it's less likely to. So it's likely to be a facet joint issue, or it could be brain. Here is the article that I refer to give us some more kind of indicators that it could be a facet joint problem. Just understand location-wise, you may have no back pain currently at all, but joint problems in the back can not only cause back pain, but can also cause outer hip pain. Could cause outer hip pain alone, as you might be experiencing currently. Or maybe in the past you've noticed that you also get some pain on the one side of your back, along with the outer hip pain. Could it be a joint problem? And now maybe you're discovering that by walking through this flowchart. Versus problems on the outside of the hip joints, the bursa, the tendons, things like that. Even the hip joint itself does not cause pain above the level of belt line in the lower back, but just to the outer hip. So location is helpful. Pain may be better while walking or sitting. That's not super helpful. There is no pain when getting up from sitting, and coughing, sneezing, and straining does not increase your symptoms. If we're at this point in the flowchart, then chances are it's a back problem. Well, if coughing, sneezing, and straining does increase the pain on the outside of your hip, when you cough, you feel a jolt of pain to the outside of your hip, then this is more indicative of a disc issue. So you might be one of those people who, lucky you, is greater than 50, but has a disc problem and fits all the things associated with a disc issue. We'll talk about that in a second. Facet joint problems are not affected by coughing and sneezing. Soft tissue structures like the disc are. Oftentimes with joint problems, this is the most painful test because as you rotate and extend backwards, you close down maximally on those joints and cause irritation of them. All right, so age greater than 50, we talked about the likely source there. So now you're less than 50 years old. The probability you can see here as you're younger than 50 is much higher that it's a disc, internal disc problem versus a facet joint issue. Beyond 50, disc problems reduce in probability. Doesn't mean it can't be, it just means it's less likely. So we're gonna go with disc, or it could be brain. We'll talk about that at the end. Disc, well, what kind? Chances are it's not what we call a large disc herniation or extrusion or sequestration, because this almost always presents with, yes, some outer hip pain or some buttock pain, but almost always the pain will go below the level of the knee into the foot. So it's unlikely that if you just have outer hip pain, that's the cause. So you don't have an extrusion, sequestration, or a large disc herniation or protrusion. It's most likely something that's more mild or moderate, disc protrusion or herniation on one side. And that one side probably being the side where you have your one-sided hip, outer hip pain. So again, upstream problems in the back can cause you to feel not only pain in the back, or maybe not, but also anywhere downstream, such as in the outer hip. So it's common that people with disc problems will have pain in the back, but maybe not, as you might be experiencing or not experiencing. So it's very common that people with disc issues will have back pain, but not always, and then have pain on the outside of their hip. It's possible you could just have outer hip pain alone and no back pain. But again, issues local to the hip joint itself or outer hip area do not cause pain upstream. So disc issues, often central one-sided lower back pain in the past. Maybe you don't have symptoms now, but maybe in the past you've had some central back pain that kind of shifted from right to left. There's often a roller coaster of back pain previously. So maybe you don't have it currently, but maybe in the past your back has gone out on you, and then it got better and it went out on you, and it kind of keeps coming back. Oftentimes there is trouble straightening or standing up after sitting. So notice, we go back, we were here, it's a back problem, greater than 50, probably a facet joint problem, but there's no pain when getting up from sitting, meaning facet joint, arthritic joint problems generally do not cause pain with these transitions. Coughing, sneezing, straining, that's coming next. So that's another way to differentiate. Okay, it seems like it's a back problem at this point in the flow chart, and Charlie, I'm greater than 50, but it could still be a disc problem, but it's most likely to be a joint problem, or I'm less than 50, and it still could be a joint problem, but it's more likely to be a disc problem. But you know what? I don't have any pain when I get up from sitting. Or I do have pain when I get up after sitting. Or you know what? It is worse with coughing, sneezing, or straining. So this trouble with transitions and pain that's increased with coughing, sneezing, straining, more disc-related versus facet joint problems, not. Okay, so I just wanted to zoom in on that. Pain is often worse in the morning because disc pressure is highest in the morning. Pain is often, but not always, better with walking, standing, or lying down. Sometimes you'll be shifted. So if you have pain on the outside of this hip, oftentimes you'll be shifted away from the problem. Pain on the outside of the left hip, you'll be right shifted. We call this a right lateral shift. This is a telltale sign of a disc issue. Talk about brain here in a little bit. Okay, so now let's go back. And let's just say that you did these back bends and it was pain-free right from the get-go. Or it was painful, but then when you bent the leg and sort of changed the hip position, it all of a sudden became pain-free. Well, it tells us that it's not your back. So it's not your back, but it still could be a problem within the hip joint or a problem on the outside of the hip itself, outside of the joint in the soft tissues of the glute muscles / tendon, as well as the bursa. Or, again, the brain can be pretty darn tricky. So this is the next test I want you to perform to get closer to the truth now that we're here. So I want you to perform a figure 4 stretch test. I want you to compare the painful side to the pain-free side. So let's just say you have pain on the right hip, right outer hip. Go ahead and perform this on that side. So take your right ankle, put it up on your left knee like you see here. And I want you to get an idea for how far it moves and what it feels like. And then go ahead and do it on the pain-free side. Now, if you have a hip joint problem or some sort of hip bursitis or tendon problem, this should be painful. So it's really not a question of if it's painful or not. But now we're going to look at the quality of the motion. So either it's going to be tight, the painful side is going to be tight, the knee is going to stick up in the air and it's going to be hard to put on your socks, your shoes, cut your toenails, things like that. Or it's going to be just as flexible. You're going to notice that the level of your knee is essentially the same when you compare your painful side to your non-painful side. Or maybe even your painful side flops closer to the floor. It's more flexible than your pain-free side. Let's talk about the very likely case of it being stiff and painful. So are you greater than 50 years old or less than 50 years old? If greater than 50 years old, so if you've gotten to this point in the flow chart, chances are very high that you have an osteoarthritic hip. So hip osteoarthritis, and here are some of the telltale signs. Occurs more commonly in females versus males. There's often trouble sleeping, especially as this has progressed. There's gonna be difficulty putting on socks, shoes, and cutting toenails. The toenail test, I call it, because getting this position is sort of what you would get in to cut your toenails or put on your socks. So that makes sense. That's your yucky motion. Location of symptoms. You can see here that a lot of people have pain on the outside of the hip. You may only have pain on the outside of your hip, but more commonly you have pain in the groin. You may also have buttock pain. You may even have knee pain or shin pain or pain in the ankle. So these are locations of where a hip joint problem may refer to. There's going to be pain with loading the joint. The hip joint is a weight-bearing joint. So you have the femur, you have the ball, you have the socket, and if you're climbing stairs and you're walking, things like that, you will notice that symptoms are worse. So pain with climbing stairs, there's often stiffness that improves the more you move around. So if you've been sitting for a while or sleeping, you get up and it's very stiff and painful as you start to get moving, but maybe it improves a little bit as you kind of lubricate the joint. There's generally a gradual onset versus something traumatic, which might be more like a fracture case where you fall or something like that and you have hip joint pain that hurts when you put weight on it. So gradual onset is progressively getting worse over time typically. Pain, stiffness when getting up from a sitting position out of a car. Again, there's limping when you put weight through that leg because the hip is a weight-bearing joint, and you're often doing like this wobbly walk. We call this a Trendelenburg gait. It's the idea of if you're walking in the mall or in the store or something like that, you see somebody kind of teetering like a penguin almost side to side. This points towards there being a hip joint problem or weakness of the muscles surrounding the hip joint, often due to pain. So that's hip osteoarthritis. Age less than 50 years old, so maybe you're a little bit younger. It still could be something in the hip joint, but maybe it's a labral tear you're feeling as referred pain or showing up as referred pain to the outside of the hip. There's often a pinchy feeling in the groin as well as outer hip pain, and this is going to be a really yucky motion. So painful motion, we call it fader. You're kind of pulling your hip up towards your chest. We call this flexion. You're kind of crossing it over a little bit and you're rotating it inwards, and this will often be the most painful position for people like you. You can see in the picture here some things which might lead to reduced range of motion in the hip and labral tears. So A is a normal hip joint and neck of the femur. B, you can see it's kind of thickened or fattened up from the picture in A. We call this a cam morphology, causing cam impingement. You can see if you try to lift that femur up, it would pinch things sooner. C, we call this pincer. So the neck looks pretty normal of the femur, but you can see at the socket kind of looks like it has a little icicle at the top. So it kind of closes down on the ball, and as you try to lift that up, causes pinching, irritation, or tearing of the labrum. And D here, you can see it, the socket is just really shallow. We call this dysplasia. Not as common, but it is in the picture there. So if it was stiff and painful, likely to be a problem in the hip joint affecting the motion. If you're greater than 50, hip osteoarthritis, less than 50, hip labral tear. But let's just say you did this test, it was painful, but the painful side had more flexibility or at least equal flexibility. So you haven't lost range of motion. If anything, the painful side moves better than the non-painful side. Could be a labral tear. We just went through that. So go and review that again if you need to. Or more likely, it's not a problem in the hip joint. You can see here in this little infographic or this drawing, you have a muscle which ends in a tendon. So you have the glute medius, and oftentimes gluteal tendinopathy will affect glute medius tendon as it attaches to the point of your outer hip bone, what we call the greater trochanter. And then you have the bursa, which sits right on the outside there. And you see that they're very closely related. I just colored them and pictured them here for you so you can see just how close things are. And because it's so difficult in many cases to differentiate, is it a tendon problem or a bursa problem, because they're so stinking close, we call this now Greater Trochanteric Pain Syndrome. In more simple terms, there's something on the outside of your hip around the greater trochanter that hurts. But I think we can do better than that. So some general things associated with problems on the outside of your hip joint include trouble sleeping on the painful side. Now, this could also be an issue if you have an osteoarthritic hip or if you have a disc problem or something like that. So it's not specific to this thing, but just look at the cluster of findings. There again is often pain going up the stairs because when you go up the stairs, you're contracting your hip muscles. It's pulling on this tendon, which might be irritated or degenerative over time, and it's causing you pain. You're going to notice that it's very tender to touch, and the pain is only going to be on the outside of the hip. It doesn't go anywhere else. It's just behind the point of the hip bone or right on that greater trochanter. Versus if you have a hip joint problem, the problem is actually due to degeneration of the hip joint or of the labrum itself. Pushing on the outside of the hip might not feel super comfortable, but it's not going to make you jump off the table. So if you have a bursa problem, which is inflamed, a bursas don't contract. They're fluid-filled sacs, if you will. Or you have a muscle tendon problem and you push right on this area, that is going to cause you to jump. So surgeons will often call this a positive jump sign. So you lay on down. I used to work with hip and spine surgeons for many years, and they're going to take their thumb or take their finger. You're going to say it hurts right here. They're going to push on it, and you're going to say, ow, and then they're going to give you a shot in the outside of the hip, and you're going to say, oh, I feel better for a little bit, but we actually know that can damage the tendons, the glute tendons, and make things worse. So try to shy away from those if you can. They're short-term, if that, as far as relief. Pain is going to be present if you're standing on one leg. So go ahead and try a single leg stance. And what you'll notice is that as you load those muscles of the hip and you compress the bursa, then you'll probably have pain. And now what we can do is we can start to do some resistive tests, which helps us start to differentiate between, is it a bursa problem? The bursa, again, doesn't contract, so technically it shouldn't be aggravated by this test, or a glute tendon problem. Glute tendons, the tendon attaches to muscle, and when you contract the muscle, it pulls on the tendon to produce force. Well, if a contractile test is painful, then chances are it's going to be a muscular tendinous problem, not a bursa problem. So we can start to get closer to the diagnosis based off of something we call an external derotation test. Now, this is what it would look like if you were to go to someone in person. They would pull your hip up to almost 90 degrees. They would rotate you. We call this external rotation. Your leg is rotating in, but your hip is actually rotating out, if you can picture that. And then they're going to say, okay, try to untwist, basically. Try to push back into my hand here. Try to push back. In this case, I just made it a self-test into this chair. So here's what I want you to do. I want you to lay down, hip at about 90 degrees, just like I am. Maybe there's an arm of a chair, arm of a couch, table, something like that. And I want you to try to push as if you're trying to twist your leg this way. And it's either going to be painful or pain-free. If it's painful, this points towards it being more of a muscular problem, a glute tendinopathy, probably the gluteus medius tendon, most likely. Oftentimes people have glute tendon problems versus bursa problems, as you'll see here in a moment, are a bit more active, and it just makes sense. You're stressing out your muscles more, which isn't a good or a bad thing, but it's possible that if you overstress them, you can get pain to the muscles and to the tendons, which they end in. So 40 to 60-year-old active folks, that's where we see this occur more commonly. But let's just say it's pain-free. When I contract the muscles of my hip, which attach to the greater trochanter, it doesn't hurt. Well, chances are it's something that is non-contractile, that doesn't contract. Could it be a bursitis problem? We see this in the same age range, which can make the diagnosis tricky, but oftentimes people who have bursa problems, remember the bursa don't contract, are more sedentary. So we see more compressive problems, lots of sitting, lots of inactivity. It's very unlikely that you injure a muscle and tendon if you're not using it much, if you're not active, if you're sedentary. Now, you could go one step further. You could do another self-movement test. Go ahead and perform a side-lying leg raise. So take the side of pain, where you have pain on the outside of your hip, make that the upper leg, and as if you are, laying to where your butt, your back, and your leg and your heel are all on a wall, so you're all on the same plane, go ahead and raise that leg up and hold it. And if it's painful, this points towards more of a glute tendon problem. So if you're still not sure, you can kind of be doubly sure and go through another diagnostic test to go back to it being a glute tendon problem. But let's just say that it's pain-free. Well, now you've kind of proven that you can contract the muscles on the outside of your hip and move the hip joint itself, and it's not a problem. Could it be the bursa? What if it's pain relieving? That's even more telling for me. If somebody contracts the outside of their hip and shortens the outside of their hip, and all of a sudden, the pain gets less. Not only is it not hurt, but it actually feels better. And this increases the chance of it being a hip bursa problem. It kind of makes sense. Imagine if I took this and I flipped it on the side, because now I'm laying on the side, and I raised the leg out to this side. What I'd be doing is I'd be contracting the muscle and tendon, pulling on it, which should be painful, but I'd be slackening or reducing compression and pressure on the bursa. In which case, this may explain that when you go to raise your leg out to the side, as in this self-movement test, the side-lying leg raise, you actually get pain relief from it. All right, now this is not a proven test. I'm just giving you a heads up. Okay, I don't have scientific evidence to back that, but I think it makes sense anatomically. All right, so we now completed the body side of the diagram. We talked about how to rule out the back as the cause of the problem. Back bend's either painful or pain-free, or maybe it was painful, but it was a false positive. When you manipulate the hip joint position, now all of a sudden bending backwards becomes pain-free, not an issue. Not a back problem, but instead maybe a hip problem. Problem inside the hip joint, osteoarthritic problem, labral tear versus outside. Is it stiff and painful? Probably a hip joint restriction caused by something there. If it's not stiff and painful, then it's probably not a hip joint problem. It's probably something outside of the hip joint itself. We talked about this Greater Trochanteric Pain Syndrome as sort of all-encompassing of, gluteal tendinopathy or tendon issues, as well as bursa problems and how to figure all of that out. Now, that's the body side of the equation, but what about the brain? So this is really interesting. If you're still confused or things aren't adding up, understand your mind can create very real physical pain, but it might not be due to any of these things. We ruled all these things out. Your brain can become a bit sensitized. We call it central sensitization, can cause very real physical symptoms that can mimic any of the stuff we talked about a moment ago. And here's how we help you figure out if your mind is having an impact on the symptoms you're experiencing. I go through what's called an evidence list. So we literally just ask you a series of questions, and rather than me trying to convince you, you just be the judge for yourself. And so I want you to go through each of these 13 questions, and I simply want you to answer yes or no. All right, so question number 1, are you unsure as to why your pain began? Meaning, is there no clear injury or cause for the pain on the outside of your hip? I don't really know why it started. I think it's because I was running. I think it's because I was picking this up. I think it's because I walked too far in the grocery store. If you have to think about how you injured yourself, you probably didn't injure yourself. Okay, so you would say, yes, I'm unsure. Is your pain chronic, greater than 3 to 6 months? We know that almost everything in the body heals in about a 6-month time frame. So you break a bone, 8 to 12 weeks, the bone will heal. You rupture a disc, roughly 6 months, 75% of people will be improved. So if your pain is greater than that, and your outer hip pain is lasting beyond what is reasonable for the body to repair itself, then we have to ask ourselves, is it really the body or could it be the brain? So you would say, yes, my pain is chronic if greater than 3 to 6 months. Did your pain on the outside of the hip begin during or around a time of fight or flight? Good or bad stress? A move, new career opportunity, so a promotion, a demotion, maybe you quit or you got fired, you had a baby, there's a birth, there's a death, something like that, right? So good or bad stress, anything that's going to elevate the fight or flight state of the nervous system. Did it begin around one of those times? Yes or no? Is your pain inconsistent? Do you have some good or bad days? If so, most of the time when you injure something physically in the body, it just doesn't decide that one day it's going to hurt and the next day it's not. So inconsistencies can be a clue that symptoms are more centrally driven of the mind versus the body. Does stress trigger your pain? Yes or no? If stress triggers your pain, chances are it's not physical. Do you experience relief of your pain with distraction? Do you experience relief of your pain with distraction? Meaning if you go on vacation, do you notice that my hip feels a lot better? When you come back and you've got to head back to work, do you notice that it feels worse? Do you notice that if you're hanging out, eating dinner with your girlfriends or out with your guy friends or playing video games or playing a musical instrument, that all of a sudden your symptoms get better? If so, this is not consistent with a structural issue in your body. Your glute tendon doesn't know if you're at your house or if you're at work or if you're on vacation. It doesn't just pick or choose, all right? It hurts and it's consistent. If you have pain or symptoms or problems in other parts of the body, oftentimes folks who have symptoms that are more centrally driven of the mind will not only have pain maybe on the outside of the hip, but they'll also have some neck pain, some shoulder pain, some irritable bowel syndrome, some migraines, things like that which are not easily explainable or which are chronic as well. Does your pain shift, spread, or move around for unknown reason? Charlie, I had pain on my right outer hip for one day, and then the next day it was on my left. And so is this something where your symptoms kind of jump around and you're not really sure why? If so, this might be a sign that symptoms are of the mind. Do you experience a delayed onset of pain? So you do exercises and you feel fine in the moment, but problems come on later. I don't know about you, but when you injure something in your body, when you whack your finger with a hammer, you feel it now in the moment, and then later. It doesn't wait till later to hurt. Have you been given many or no clear diagnosis? If people can't agree upon why you hurt, then it's possible that there is no clear explanation for why you hurt. It may even be possible that your hip x-ray looks fine, your hip MRI looks fine, everything looks good. It's possible that maybe it's not a structural problem. Do you identify yourself as having a high pressure, perfectionist, people pleaser, type A, good student type of personality? If so, chances are you live in a little bit more of an elevated state. The more often you're in a fight or flight state, the higher the sensitivity of the alarm system, your central nervous system. This can cause you to feel or experience greater pain symptoms. Is it hard to identify yuck emotions that clearly and consistently reproduce your pain? If you have a hip tendon problem, a gluteal tendon issue, or a bursa problem, you should be able to make it worse. If you have a hip joint problem, you should be able to make it worse consistently by moving your hip joint in certain positions. If you have a back problem, you should be able to close down on the joints of the discs or the structures, the nerves of your spine, and recreate your pain. But if sometimes you move your hip and it hurts, and other times you move it and it doesn't hurt, and things are inconsistent, then this is what we call an unclear movement-pain relationship. That is not consistent with a structural problem. And has there been a lack of response to physical treatment? If the problem is physical and you're treating it as a physical problem and you're doing all the right treatments, assuming you are, then why wouldn't it get better? Maybe because it's not a physical problem to begin with. So if you answered yes to 7 or more of these 13 questions, then the probability shifts to the majority. The symptoms are more centrally driven of the mind or of the brain. Again, very real, but we need to address the central nervous system in our treatment approach. If you answered yes to 6 or less of these 13 questions, chances are it's a problem within the body, but maybe we need further evaluation. Okay, so there you have it. We went through this evidence list. You answered yes or no to these questions. By now, you should have a good idea of if it's of the body, well, what's causing it? Is it possible that it's of the mind? You thought it was of the body, but now you're realizing maybe there's nothing damaged or broken in my body. Maybe my central nervous system is stuck on high alert. So we helped you figure out the most likely cause of your outer hip pain. If you want to figure out how to solve this naturally using the power of your mind and movement as medicine, be sure to check out the other videos on my channel. Thanks so much. Let me know below, what is the most likely cause of your outer hip pain? Thanks.